It's Monday, March 1st, and the time for your Barbados Today Morning News Update. President of the Democratic Labour Party, Villa de Pisa, has expressed concerns about the government's proposed national vaccine fund. During a national address last week, Prime Minister Mia Mottley announced the pending launch of the fund, to which Barbadians will be asked to donate to help cover the cost of vaccines. However, speaking on the DLP's virtual program last night on the topic, The Two Sides of COVID in Barbados, de Pisa argued that now was not the time to introduce anything new, as quite a significant number of Barbadians were in dire financial straits due to the COVID-19 pandemic. She suggested other ways the vaccine purchase could be funded.
We came up with 6. There could be more, but we came up with 6. First of all, going on the central bank report, the foreign reserves leave space for us in terms, even though that is borrowed funds, we still have a gap of about $80 million to still meet that 1% surplus that the government is seeking to achieve under the revised IMF program. So there is a source of funds that can be used. We have also the BEST program, which is significantly undersubscribed to the extent that $300 million that was set aside for tourism-related businesses to capitalize themselves and improve during the COVID struggles remains unused. Some of those funds, not all, but some of those funds could be repurposed to pay for the vaccines. We also have, in terms of the reserves, we were told that we had 35 weeks of coverage for our reserves. That is way ahead of the international standard for reserves. So again, we have some space. Those are 3 so far.
De Pisa also made reference to the garbage and sewage levy.
Truthfully, nobody knows yet how much money the garbage and sewage levy has brought in, because those are funds that should be reported by Barbados Water Authority as the collection agency, but we haven't seen any financial statements for any of the relevant periods. But if we had an accounting of that levy, maybe, just maybe, we will find that there are some funds in that levy that could also be put towards the vaccine. It would call for some legislative change, but let's face it, they have the majority in Parliament that they can make that legislative change and effect the transfer of funds which are not in the consolidated fund, but are funds that belong to the people of Barbados and can be put to use for the people of Barbados. And then, of course, we heard last year about the COVID-19 Relief and Recovery Barbados, Inc., a company that was set up to source funding from out of the diaspora. We have never had a reporting in relation to that company either. So we need to know what funds are in there, whether any is available for vaccines. And then, of course, the bloated cabinet and all of the consultants.
Barbados continues its national vaccination program today with a plea for residents to honor the appointment system so senior citizens, the most vulnerable, and frontline workers can get their doses first. It's coming from co-coordinator of the National Vaccination Committee, Major David Clark. As of Saturday, health officials had vaccinated 36,749 people with the Oxford AstraZeneca vaccine. That's a breakdown of 15,678 men and 21,071 women. However, the national vaccination effort and systems have been overwhelmed by what has been described as the enthusiasm of Barbadians, many of whom without appointments or being on the urgent list, turning up at centers across the island, resulting in crowds and long lines. Major Clark said this should not have occurred and urged the public not to turn up at vaccination sites without an appointment, as the numbers of people at those centers crowded together and not observing physical distancing rules is itself a health risk. At the same time, President of the Barbados Association of Retired Persons, Marilyn Rice Bowen, has recommended that the national COVID-19 vaccination program be suspended for a day to allow for an urgent evaluation of the initiative. In a statement, Rice Bowen pointed to 3 specific areas BAP wants to be reviewed based on the number of persons vaccinated so far.
What is the age breakdown of those vaccinated? 2. Is the Ministry of Health satisfied that of the approximately 68,000 people over the age of 70, that an adequate number has been vaccinated? And 3. Should the vaccine be extended to other groups at this stage? Barb's concern is directed towards the health and safety of the over 70s, and given the high number in this age group who have died already this year as a result of COVID-19. The best way to demonstrate our admiration and gratitude to our seniors for their contribution to this country's development is by protecting them and also helping them to safely survive this pandemic.
Meantime, the Pan American Health Organization has obtained 357,600 doses of the Oxford AstraZeneca vaccine for Barbados and some Eastern Caribbean countries through the COVAX facility. Of that amount, Barbados will receive 100,800 doses, while St. Lucia will get 74,400 doses. Antigua and Barbuda, 40,800 doses, St. Kitts and Nevis, 21,600 doses, Grenada, 45,600 doses, Dominica, 28,800 doses, and 45,600 doses will go to St. Vincent and the Grenadines. In a statement, PAHO said it was working with its member countries to close the purchase orders, and countries will start receiving their first vaccines through COVAX this month if all the conditions are met. COVID-19 cases in Barbados climbed to 3,068 over the weekend after 13 new positive cases were recorded on Saturday. 63 people recovered from the virus and were discharged from isolation, bringing active cases in the country to 628. The 13 new cases comprise of 12 men and 18 women, the majority of whom are Barbadians. Also, of the total confirmed cases on island, 1,435 are females and 1,633 are males. 2,407 persons have recovered from the virus and 33 people have died. To news from the region, investigations continue in Haiti following a deadly prison break on Friday. More in this report from France 24. And finally, top U.S. infectious diseases expert Dr. Anthony Fauci tells Americans they can take any of the 3 COVID-19 vaccines now available to them. More from Reuters TV. That's news, but for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM. COVID-19 cases in Barbados climbed to 3,068 over the weekend after 13 new positive cases were recorded on Saturday. 63 people recovered from the virus and were discharged from isolation, bringing active cases in the country to 628. The 13 new cases comprise of 12 men and 18 women, the majority of whom are Barbadians. Also, of the total confirmed cases on island, 1,435 are females and 1,633 are males. 2,407 persons have recovered from the virus and 33 people have died.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, investigations continue in Haiti following a deadly prison break on Friday. More in this report from France 24.
Trying to regain control after Haiti's largest and deadliest prison break in a decade. Haitian authorities are scouring the country for remaining escapees. Officials said on Thursday that more than 400 inmates had managed to flee the Croix des Bouquets jail, which had been holding nearly twice its capacity of inmates.
Before yesterday's incident, there were 1,542 prisoners in the prison of Croix des Bouquets. After the checks were made today, we see 1,125 prisoners who are in prison.
Among those that the police managed to track down, one of Haiti's top gang leaders, Anel Joseph. Once Haiti's most wanted fugitive, Joseph had already tried to escape in July after announcing his intentions online. This time, the convicted murderer was spotted at a checkpoint and killed in a gunfight with police. During the jailbreak, other prisoners were killed, as were bystanders and the penitentiary's director. On Twitter, President Jovenel Moïse condemned the breach and instructed the national police to use all measures.
And finally, top U.S. infectious diseases expert Dr. Anthony Fauci tells Americans they can take any of the 3 COVID-19 vaccines now available to them. More from Reuters TV.
Senior U.S. White House officials said on Sunday deliveries of the newly approved Johnson & Johnson COVID-19 vaccine should start on Tuesday. It will become the 3rd vaccine made available in the U.S., but officials are noting a lag in reaching minority communities. One official said vaccinations for Black and Brown Americans were, quote, at rates lower than the representation in the general population. Although they gave no data on the disparities, federal officials have ensured that distribution has been fair. They've also acknowledged concerns raised by some Black Americans, given the country's history of past disparities, and a decades-long experiment in which Black men had been denied treatment to study syphilis. Officials have underscored the importance that anyone who can get vaccinated should do so as soon as possible. They've also sought to assure minorities of their safety.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.